Touch briefly on fibromyalgia.
Yes.
What is it and how can people live with it?
Fibromyalgia. Now, this is a topic that I've been asked a lot of questions about since my segment on This Morning. So what is it? Let's get into it. Now, fibromyalgia is a long-term condition, also known as fibromyalgia syndrome, and it basically causes pain all over the body. As well as all over body pain, there are a whole host of symptoms that you might get, and these can include things like muscle stiffness, fatigue, fibrofog. This is where processing things are a little bit slower maybe. You might also get things like low mood, or you might feel that you're worrying a lot more. Irritable bowel syndrome, also headaches, and also issues with sleeping, and these are a few of the symptoms that you might get with fibromyalgia. So what actually causes fibromyalgia? Now, on the This Morning segment, we didn't actually go into the causes very much. So basically, it's not clear exactly why some people get fibromyalgia, but there's an understanding of some of the factors that might be involved in those that get the condition. So the first thing to consider is genetics. Now, research has shown that there might be a small part to play when it comes to genetics and fibromyalgia. And the other thing to consider is the possible triggers. Now, there has been a thought that fibromyalgia is more of an autoimmune condition. This means that the immune system itself isn't functioning how it should be and is actually attacking the body in some ways. And it is thought that the trigger to this is basically a build-up of a number of events, not just one thing. You don't get fibromyalgia overnight. Normally, it's a collection of triggers that may have happened which have led to the diagnosis of fibromyalgia. Things like significant emotional trauma, serious incidents like car accidents, for example, and also viruses like Epstein-Barr virus are some of the things that are thought to maybe contribute to the triggers that may lead to fibromyalgia. Fibromyalgia is one of those conditions where we definitely need more research in the area of how it's caused and the processes that lead to it. This is what we know so far. So how can fibromyalgia be treated? Now, the first thing to talk about is lifestyle changes. And often when we speak to patients about this, they might feel like they're not being taken seriously, but actually lifestyle changes can have a huge impact on your management of fibromyalgia. So it is important to take lifestyle measures seriously. So these changes are things like exercise programs, so low impact exercises, gradual exercise, relaxation techniques, so making sure that you're getting involved in mindfulness, deep breathing, maybe yoga, for example. Also having a healthy balanced diet can be really helpful. So anti-inflammatory foods, lots of fruit and veg, legumes, lentils, and a nice balanced diet to ensure you have energy as well. Sleep is another huge lifestyle change to be considered when it comes to managing, especially the fatigue associated with fibromyalgia. Ensuring you're getting enough sleep, and you are practicing sleep hygiene, so putting your blue light screens away, ensuring that you are taking time to relax before bedtime, that you're getting a full 7 to 9 hours of sleep every night where possible. Also important to think about pacing techniques, so don't overdo activities. Try to break them down through the day so that you don't get increased fatigue and that you're not overwhelmed or overstressed by activities that you've done through the day. And then, of course, we can turn to medications as well. So there are things that we can offer to help with the pain that you might be experiencing. So these are medications that may be prescribed by your doctor. Also, if you're experiencing mood changes, we can give you medications to help with mood, to stabilize the mood. And this is something that can be given for a short period of time. We can work with you to see how long you might need these medications for and then taper them off as and when you're feeling slightly better. So in conclusion, fibromyalgia is a complex condition. There's no one fixed answer overnight. So if you're suffering from it, it's really important to speak to your doctor. And there are lots of support groups available as well. One of them is Fibromyalgia Action UK, and they have lots of coordinators that can help you to get support near to where you are. Hopefully you found that video useful. Let me know your thoughts about fibromyalgia in the comments. I'll be really interested to know.